Oh, that's loud. All right. Got it.
They letting you know, okay? Um,
Yeah, they are.
Hi, Miss Robinson. How are you?
I'm doing well. How are you?
I'm doing well. Thank you so much for joining me for the HBCU Cares interview series, where you will share about yourself and the work that you do in the behavioral health field. Um,
Hmm.
I am Christina Brantley. I'm currently a third year student at Clark Atlanta University in the school counseling program and currently at a middle school for my internship. So, could you tell me a little bit about yourself and what it is that you do in the behavioral health field?
So, a little bit about myself. So, as you stated, my name is Stephanie Robinson. I've been a psychiatric nurse for about the last 8 years. Prior to that, I was a U.S. Army veteran, sergeant. I did one tour in Iraq, 2008, 09. I've been probably through the whole gamut of behavioral health settings as they relate to psychiatric nursing. So I've worked inpatient, I have worked outpatient in mental health clinic, done partial hospitalization programs. I have done psychiatric home health during COVID, which was a big thing because a lot of the doctor's offices had to close, so they couldn't treat or they couldn't really have patients come out to the offices to get treated. So when you look at people who have these chronic mental illness, especially the psychotic disorder kind, schizophrenia, those people are usually stabilized on long-acting injections. So if they can't come to the office to get those, then they have a higher probability of actually being hospitalized at that point. So I've ventured into psych home health for some time during that pandemic. Um, then I went back inpatient and decided to move completely away from bedside into leadership. And currently, I am at Shepherd Pratt, um, one of the probably one of the largest names that I know in terms of behavioral health. Right now, I'm a senior director of nursing for clinical services across our Baltimore, Washington, and town campuses. And this is for the adult service lines and really all of it. So I have adult service line, I have child and adolescents, and then I have specialty units such as geropsychiatry and eating disorders, which was really interesting for me to learn about because people, when you think about psych and behavioral health, people don't really talk about eating disorders a whole lot. So it was really interesting to actually become exposed to that. Outside of Shepherd Pratt, gosh, what do I do? What do I not do? So I'm a clinical supervisor for undergraduate students at Stevenson University. I recently interviewed for an adjunct faculty and was offered a position at Coppin State. So I'll in the spring, I will start with BSN students, or again, undergraduate nursing students, teaching mental health and then having clinical rotation as well. I am a volunteer with NAMI Metropolitan Baltimore. I really love them. We do this really kind of inspirational one where we go out and we talk to the Baltimore City Police Departments and we walk them through what it's like to be able to recognize someone who's having a behavioral health emergency. And I really love that exercise because there's such in the media about how people or persons who are in behavioral crisis lose their lives a little bit too early because persons can't uh, persons can't recognize that they're struggling and need help. So programs like that, the development of 988, where they're really good and dear to my heart for this population. Other things, my company and some others, we actually just chartered the DMV chapter of American Psychiatric Nurses Association. So that's kind of a big thing because it didn't exist before. My understanding is they tried to create one before, but they didn't have the bandwidth. There weren't enough people. So we came together and we've chartered it, and that's going to get introduced to the APNA next month actually. So it's kind of a big deal. I think that's enough. I think I think that's everything I do.
But it's not, I know it's not. Because when you run it down a list like that, it's very easy to forget something, but it just shows how much you are invested in the work that you do. And I think even my follow-up question is going to be hard maybe to answer, or maybe hard isn't the right term, but your work is extensive. Like, you have done so many things and touched so many aspects of this work. So when I ask you, how did you choose this particular path? I don't know that, you know, I'm I'm on the edge of my seat waiting for what you're gonna say, because even the role that you're in now, you chose that for a separate reason, that you probably decided to um, come into behavioral health. So however you want to tackle how you got to this place currently, I'm gonna let you take it away. I won't even
Mhm.
try.
Mhm. Well, it's funny that you should say that. I just recently spoke to a group of probably about 30 nurse graduates in a nurse residency program that they had. And I asked persons to raise their hand who had always known that they were going to come into psych. And about 10 of them raised their hand. I was not part of that 10 when it first came down when I first graduated. My career trajectory has been honestly has been all over the place, and I actually credit it stabilizing and really finding a path to when I had my daughter. So like I said, I started off as a medic. After I was a medic, have been multiple types of technicians. I've been an EMT. At one point, I was interested in hyperbarics. I was a pharmacy technician. I was just doing technician stuff. I was all over the place. Then I ventured into bedside nursing. I've been in case management, clinical director, senior director, soon assistant chief nursing officer. We're gonna type that into existence. But how did I end up in psych? So, given my background, I always thought that I would be a trauma nurse or maybe emergency department or something like that. Something fast paced, blood, gory, rapid turnover, whatever. But I was a patient care technician in South Carolina while I was in, I think my last year of nursing school, and there was a gentleman that came in, and I remember him so vividly because it was just so astounding. I'm like, oh, I need to be in this field. So he was about 6'3", maybe 300 pounds. I mean, everything about him very manly, full beard, hair everywhere, all that stuff. But he was what we would call now pleasantly psychotic. The gentleman thought that he was the Queen of England, and so when you engaged with him, he would answer in a way that had like this faux British accent. Um, I remember being asked to, as a tech, you're going to get basic things like vitals, if they have to use the restroom, but they didn't want him to leave the area, so they asked me to use a urinal. So I presented it to him, I need a urine sample. Can you please use this? And he was like, well, you want me to use this chamber pot? And I'm like, back then we don't have masks. So there's no, talking about professionalism and walking and keeping it a straight faced, right? So we get through that, and I'm trying to get his vital signs. I ask him, well, how do you know about how much you think you might weigh? And he starts touching himself. He's like, well, I've been told I need to lose some poundage. And I was like, oh my God, okay, fine. So so fast forward to my actual psych rotation in school, because I went to Clemson for my undergrad, actually. Um, and I was at Patrick Harris Psychiatric Institute, it's a state psych facility in Anderson, South Carolina, and I saw the same gentleman. Now, this guy it was night and day. Now, obviously, he didn't remember me, but I remembered him. and sat down with him as a nursing student. We're talking, he's telling me about how he's about to get discharged, he's gonna go live with his sister, you know, very logical, very goal oriented. We're playing cards. I mean, good it was a good visit. Like, and to me at that moment it like clicked like, oh, this is real. Like this I remember this guy. He was out of his mind, respectfully. But now he's got it back together. So this is real. This is not like what they show you on televisions with the padded rooms and the and all that people sitting down drool. It's none of that. So it was really beautiful, and I've been with psych ever since. Um, that same place, actually, I ended up taking a nurse externship over the summer, and that became my first nursing job as well. So I worked there working with in crisis stabilization for adult males, and then I went to another magnet facility after that, and then after that I relocated back to Maryland. So that's kind of how I got into psych. What kind of keeps me here is I love rooting for the underdog. And in terms of Black mental health, it's very important to me. We don't have enough representation, we don't have enough education, and we don't have enough advocacy. Um, there's a huge, psychiatry, behavioral health is a very large stigmatized area in our community, and also, unfortunately, in nursing practice. And nearly 5 million Black or African American people report a mental illness a year. Less than 10% of those people actually go get help. And so much more of our people are more likely to suffer imprisonment or end early life because people couldn't recognize that they had a mental health crisis and needed assistance. So do I know that I can't single-handedly change all those things myself? I'm realistic. I know that. But I also know that I can affect my bubble, my community. Um, and I'm proud of that. I took a picture. I was actually meeting with my managers today, and I took a picture after we had our meeting. And I said, y'all, this is completely off topic, and I apologize. But when I looked around that table, there were nothing Black nurse leaders. And it made me feel so good because this time last year, there was only one. Excluding myself, there was only one. But this year, there are seven. There are seven, and I brought five of them on. So I just felt I'm like, y'all, we are the representation. This is what we're fighting for. We're fighting for our community. So I just want y'all to be really proud of that. And and honestly, that's why I love what I do. Yes.
Come on and take us to church, Miss Robinson. This is beautiful. And what I didn't know in our introduction is that you are an HBCU CARES ambassador alum, speaking like a true ambassador. So the work that you're saying is, or the work that you're doing is so important. And when you talk about the representation that's needed, the advocacy that's needed, more of us being at the table, that's literally what we talk
Mhm.
about in a lot of our HBCU CARES professional development days, and just wanting this work to spread far and wide and get more of us at the table. So the fact that you're doing that as a byproduct of loving the work and being in leadership and wanting more of us there is just incredible. So thank you for the work that you're doing. You are appreciated.
No,
Um,
no problem. Thank you.
um, so I feel like this journey, it educational wise can go a lot of different ways. So when we put your title up, people see MSN, RN, PMHBC, MPD.
Oh,
Like they will have the alphabet soup. So could you briefly talk about the education that was needed and the training that was needed for I don't even know, like the role that you're in now or what your educational look like, however you want to share that to help somebody else on their path.
okay. Well, myself, I'm an overachiever a little bit. A little bit. Like I believe that you're gonna do something, do it all the way and become an expert. I think a lot of people kind of chase money, so to speak, and these career paths that they go into. And I'm in a place now where people are actually just trying to throw it at me. And I'm like, nah, I'm good. Actually, I'm good where I'm at. So, leave me alone. But I say all to say, the more education experience that I've amassed, the more, I guess, the better I feel about what I'm doing in my role, but also the more that other people are recognizing. So, in order to be the senior director, yes, you did have to have a master's level degree or higher. So, I do have my master's of science in nursing. My focus is nurse leadership and management. The obnoxious other letters that I have after my name are all certifications. So the PMHBC, so BC means board certified. It's just meaning that I went through the American Nurses Credentialing Center in order to get those. But the PMH is a psychiatric mental health nurse. So that means that, if you look at me, anybody that has PMHBC, that person, their specialty is psychiatric nursing. So I would expect them to be well versed in anything that has to do with behavioral health in terms of nursing, right? NPD, again, I really I learned that in being in leadership, I really like developing and I really like teaching people. So I went and I got this certification. It's in nursing professional development. So it's basically helping people gain knowledge or bridge that gap between what your clinical competence is with your experience, because even though you can read everything a book and it's found give you foundational skills, your experience is just as valuable. Merging the two together makes you a wonderful leader and nurse. And then any is nurse executive. So that's just a leadership and management certification that says I understand, laws, regulations, employee engagement, et cetera, those kinds of things. Um, what I hope to do, I never actually thought about it until this year, is move into an assistant chief nursing officer role. I have a very grand vision of what I'd like to see psychiatric nursing look like at my organization. And I think they're about ready to hear it at this point. They're about ready. So I'm looking forward to finishing this semester and actually finishing with Coppin in December for my Doctor of Nursing practice. And that'll be it. I'm done. That'll be it.
No, some certifications gonna come up and you're gonna be like, I might get that one too.
Actually, you say that, and it's so funny. I have this book. I have this book now that I actually am studying, but I put it down.
Okay.
It's it's for the CPHQ, and it's the Certified Professional in Healthcare Quality. But after that, that's it.
See, no, because
That's it.
you didn't include that when you said it was gonna be the doctorate at Coppin and we was gonna be done,
Ah,
but we're not gonna stop this
yeah.
black girl magic, okay? I'm not gonna
Oh,
stop it, and I encourage you to keep going because if your daughter got you in this, I know she has to be so proud of her mom. Or the older that she gets and the more that she understands the work that you do, the more proud
mhm.
of all the things that you've done. And just when she maybe one day will watch this and know she's a part of the reason that her mom is so incredible. Um,
Ooh, she only knew.
yeah.
I told her, I was like, you helped me focus.
Hmm.
You did.
Yep.
You
Well,
did.
cheers to baby girl. Um, so, in the roles that you've had, or either in your current role, what's the most rewarding thing about your job?
Um, I think from a patient care aspect is seeing people regain some sort of control over their diagnosis, and learning to separate themselves from it. I.e., there's a group that I always ran when I was in an outpatient clinic. It was, having people introduce themselves and talk about, their illness because they may have to do that. And they're like, "Oh, hi, my name is Joe and I'm bipolar." No, Joe, you're Joe and you have a diagnosis. Separate yourself. You live with this much like anyone else lives with diabetes or high blood pressure. It is a chronic illness, but it's not who you are. It's not who you are. So, but you have to believe that first, and then that dictates how the rest of the world or whoever comes in contact with you treats you. Um, in terms of a leadership perspective, I don't know. Issa Rae said it. I'm rooting for everybody black. So when I see, like I said today, when I looked at that table and I seen all those black nurse leaders, those female black nurse leaders, it just did something to me. And like, so that's what I want to see. That's what's rewarding for me. Those people that have been in the organization for a while, and they've been kind of the worker bees, knowing that they wanted to do more, knowing that they had the ability to do more, but not really feeling supported, not being encouraged. And then I come in there and I plant that little seed, and boom. Now they're all sitting at the same table, and now they feel like they deserve to be at that table. I'd be like, I love that for you, sis. Love that. So that's probably rewarding, seeing people actualize their potential or increase it.
I love that. And when in one of our courses, we talk about, you know, putting the person first. So the example that you gave with Joe, it's like, no, Joe, you have, this diagnosis, but sometimes we have to get our clients to believe to put themselves first and not what
Mhm.
they're experiencing first. Um,
Mhm.
and just come on, leadership. I love that for you. um, okay, so now we've talked about the good. Can we hear a little bit of the challenging parts of the field? Uh,
Um, so the challenging part of the role might be trying to find a comfortable work-life balance because uh, it's a 24/7 thing. If there's some kind of major incident that occurs, my phone's gonna go off, or I'm gonna get emails or whatever it is. So trying to separate when it's time to separate. I'm really bad at going on vacation and not checking emails or responding. I'm really bad at that. Um, but I'm trying to do better. Um, in terms of the field itself, there's just not enough providers. There's not enough beds. There aren't enough people that are willing to do this work to take care and manage the people that need it. So it always seems like there's a demand for us to do the work, but we don't always have the resources that we need. Um, and unfortunately, until there's some, really tragic mass incident, nobody really believes in the work that we do, you know. So I would like to see those stigmas, even you get stigmas in society because people don't understand it. But I need to see the stigmas against actual clinical personnel who understand, you know, who truly understand the basis or how behavioral health illnesses and things occur, down to what pathways or what neurons, what sensory deficits, all of those things, and it's still a stigma. So that sometimes navigating that, I'll call it navigating the ignorance of the field. That's what I'll call it. It's difficult.
yeah, absolutely. And I hope that that doesn't deter anyone from doing this wonderful work that oftentimes people in these positions feel called to do it. Um, so
Mhm.
if someone isn't discouraged and they decide this is still for them, what advice would you give to a person that's trying to find their way on this journey to either be in this field or the behavioral health field in general?
Well, if you want to be a psychiatric nurse, I think first you're going to have to be selfless. Like nursing to me is more like a calling. This is not just a regular 9 to 5 job. As much as you hope that you go and clock in and clock out, so to speak. Sometimes you take what happens in these patients' lives. Sometimes you take it home. Sometimes it'll humble you to let you know, I was just complaining about this, but it, it really ain't that bad. It's really not that bad. Um, I would say if you're going to go into nursing in general, find a path that doesn't feel like work. Something that you're going in because you have a cause. I want to make this better. When you have that in your heart, your practice is led that way. Every day you come in and deal with patients. If nursing is not really your thing and you'd like to go into social work or or any other field but still deal with behavioral health clients, do that too. Experience it. There's a variety of settings that either clinician can work in. If a hospital's not for you, you don't like that, try outpatient, try a school, try virtual. There's so many different options, but just try, just try. Because our people, our community, we need that. We do.
Absolutely. So we will end on the note of we need y'all. So whoever is watching and considering behavioral health, um, think about it. And we hope that it's a decision that you make because as Ms. Robinson shared, she had two people on the team perhaps that looked like her. And today there were what, seven?
Mhm.
Yeah. So we need these numbers and we need more people that look like us to take care of us. Um, so, Ms. Robinson, thank you so much for being a part of this HBCU Cares interview series. I for sure have enjoyed it, and I hope that our viewers enjoy it just as much.
Wonderful. Thank you for having me. It's a pleasure.
Of course. Thank you.